What causes swallowing problems with thyroid nodules? Imagine feeling like food is getting stuck in your throat or experiencing a choking sensation when you try to swallow. These are common concerns for people with thyroid nodules, and understanding why they happen can help you feel more in control. Swallowing problems related to thyroid nodules mainly happen because the nodules physically press against the structures involved in swallowing, especially the esophagus, which is the tube that carries food from your throat to your stomach. The thyroid gland sits at the front of your neck, wrapping around your windpipe, and is very close to the esophagus. When a nodule grows larger, especially on the backside of the thyroid, it can push against the esophagus, making it harder for food to pass smoothly. This pressure can cause a feeling of fullness or a lump in the throat, often called globus sensation, and can make swallowing uncomfortable or difficult. The process of swallowing involves muscles, nerves, and valves working together perfectly. When a large thyroid nodule or an enlarged thyroid, known as a goiter, develops, it can narrow or kink the esophagus. This physical change can lead to sensations like food getting stuck, choking, or discomfort when eating solid foods like bread or meat. Liquids usually pass more easily because they requiring less effort to move through a narrowed passage. Sometimes, the pressure from the nodule can cause pain when swallowing, known as odonophagia, or even affect your voice if nearby nerves are pressed, leading to hoarseness. In more severe cases, food might enter the lungs if it regurgitates or if swallowing becomes very difficult, which can cause respiratory infections. The size and position of the nodule are important factors. Larger nodules or those located toward the back of the thyroid near the esophagus are more likely to cause swallowing issues. It's important to note that both benign and malignant nodules can cause these symptoms, but having swallowing problems does not automatically mean the nodule is cancerous. Sometimes, thyroid conditions like hypothyroidism, Graves' disease, or Hashimoto's thyroiditis can cause the gland to swell, adding to the pressure and further affecting swallowing. If you experience these symptoms, seeing a healthcare professional is essential. They may perform a physical exam, ultrasound, or other imaging tests like a CORT scan to evaluate the size and location of the nodule. Sometimes, a biopsy is needed to rule out cancer. Treatment options often involve removing the nodule or part of the thyroid gland to relieving the pressure and restore normal swallowing. In summary, swallowing problems with thyroid nodules are mainly caused by the physical pressure the nodules exert on the esophagus and surrounding structures. This pressure disrupts the normal flow of food, leading to sensations of obstruction, discomfort, and other related symptoms. Remember, if you are experiencing these issues, consulting a healthcare professional is the best step to find the right diagnosis and treatment plan.